We start then with growing concerns over a suspected outbreak of Hantavirus, a rodent-borne infection, on a cruise ship currently in the North Atlantic Ocean. 3 passengers have died and at least 2 crew members are sick, requiring urgent medical attention. But authorities on the nearest island, that of Cape Verde, are not allowing the ship to dock, fearing the spread of the disease. France 24's Daniel Quillen has our first report.
It's a cruise ship that's turned into a nightmare. On this Dutch ship, the MV Ondius, several passengers are believed to have been affected by the Hantavirus infection, a disease that can cause acute respiratory syndromes. According to the World Health Organization, 1 case has been confirmed in the lab.
Hantavirus infections are typically linked to environmental exposure, meaning exposure to infected rodents' urine or feces. While rare, hantavirus may spread between people and can lead to severe respiratory illness and requires careful patient monitoring, support and response.
A 70-year-old cruise passenger was the first to show symptoms. He died on board the ship. His wife also succumbed to the disease after being treated in Johannesburg, South Africa. According to the South African spokesperson, at least 1 passenger has also been admitted to intensive care in the country. The ship, which can carry 170 passengers, was travelling from Argentina to Cape Verde. On Sunday evening, it was moored off Praia, the capital of Cape Verde. According to the WHO, laboratory tests and medical investigations are underway. Other sick people may be placed in isolation in a hospital on shore.
Well, I'm pleased to welcome now to the programme Adam Taylor. He's a professor of anatomy at the University of Lancaster in the United Kingdom, where he is something of an expert on hantavirus. Hello to you and thanks for speaking to us here on France 24 today.
Good afternoon, thank you.
Look, this isn't the first time hantavirus has made the news. It was last year that the wife of Gene Hackman, Betsy Arakawa, died of complications linked to the infection. But what is it now that is particular and concerning about an outbreak on a cruise ship?
The concern on the cruise ship at the moment is around how these individuals have sadly succumbed to the virus and where the virus may have originated. So what is their point of contact? Have they picked up their exposure to the virus prior to boarding the ship, maybe on an excursion where they've stopped somewhere along the way, or has this virus somehow been picked up on board the ship? And the concern will be, how is it being transmitted? As we know, a number of people have sadly died and a number of other people are unwell, either in hospital or on board. And so those are the pertinent questions that we're really trying to get to the bottom of at the moment.
Yeah, as you say, the numbers we're not exactly clear of at the moment. We have 3 people who have died, 1 of whom is confirmed to have the virus for the moment, but there are a number of other people on board sick. Certainly 2 crew members are unwell. Given the incubation period of this virus is rather long, something like up to 8 weeks, do you think it's likely that there are currently more cases on the ship that haven't been diagnosed yet?
That's a good question, and it's incredibly difficult to answer. Obviously, that long incubation period of up to 8 weeks, up to 2 months, is the longest period that we recognise clinically for manifestation of symptoms. But sometimes some forms of the virus can present in a number of days or a smaller number of weeks, 2 or 3 weeks. Hence, why the investigations are ongoing, trying to determine exactly what the point of contact and exposure to the virus is, because 8 weeks is a long time, and that would fit roughly with 8 weeks prior to the vessel leaving its port of origin, but we just don't know at the moment. So the other thing you have to consider is that, well, some people have become symptomatic and have sadly died. Hantavirus doesn't always display symptoms. People can have very mild infections or can be completely asymptomatic, and that's one of the challenges that will be ongoing at the moment, is to determine exactly how many people may be carrying the virus and may be unwell with it.
And look, there's been 2 different messages today, one from the World Health Organization here in Europe and one from authorities on the island of Cape Verde, near to where this ship currently is. The WHO saying, look, there is currently no wider risk to the public at large here, but authorities on the island are saying this ship can't dock because it's concerned that there could be more infections. Who do you think's called it right here?
So we can completely understand officials on the island and their position. An island nation is going through what would be a sensible response to as yet a not fully understood outbreak of a virus. However, the WHO advocating that there is low risk is correct. This virus is not known for human-to-human transmission. Yes, there are a small number of cases where it's been reported of a specific type of the virus, but on the whole, this virus, for humans to catch it, you have to come into contact with rodent feces, rodent urine, or saliva, and inhale the aerosolized particles to stand a chance of becoming infected. So absolutely, the risk is incredibly low, and the biological processes that have to happen for somebody to be exposed to the virus, to become infected, and then for that virus to go through their system and be in a state that it can be shed and transmitted to another human being is a very long and complicated process. So the risk is low, but it is completely understandable why officials in Cape Verde are currently refusing to let the vessel on board until they have a clear picture of exactly what is going on board that vessel.
Yeah, and as I say, we've got a number of people who are ill. They will need hospital care of some kind, we imagine. How serious is this likely to be for those individuals? Because we understand there is no vaccine for the hantavirus.
That's correct. There's no vaccine, and there's no way to prevent the virus once it's in the body. So what we have to do is focus on managing the symptoms of those individuals. Now, what we're hearing is that more than likely those individuals that have been infected and sadly died in this instance have had cardiac or cardiopulmonary symptoms, and therefore we're thinking about how exactly do we manage their symptoms. So fever, nausea, vomiting, gastrointestinal symptoms are all common, and they're obviously relatively straightforward to manage. With fluids is the biggest thing if you're losing fluids through vomiting and diarrhea. But until people are significantly unwell, there's no reason for them not to be able to manage those symptoms on board. And it is a case at the moment of getting to the bottom of what exactly the strain is, how many people are infected, and then thinking about how to manage those individuals that may need further treatment. But until people have a full picture and aware of exactly how many unwell individuals there are, the status quo is a sensible position to be in.
All right, great to get your analysis. Thank you for your time, Professor Adam Taylor, talking to